Call the member for Paterson.
Madam Deputy Speaker, last Friday my constituents awoke to read the front page of the Daily Telegraph and it says the hit list, 117 health services at risk of closing. In an article by Simon Benson, it says, and I quote, "This is a list of 117 New South Wales hospitals senior health clinicians claim will struggle to survive under Kevin Rudd's health reforms." It goes on to say all are currently block funded and considered financially unviable under the federal government's plans for pay-for-service model. They don't perform enough medical procedures to fund their own existence. Madam Deputy Speaker, in my electorate, the target hit list includes Gloucester Soldiers Memorial District Hospital, the Bulahdelah Hospital, Nelson Bay and District Hospital, the Dungog Community Hospital. The report by Simon Benson goes on to quote New South Wales health officials, including some of the country's leading surgeons, claiming more than 100 New South Wales hospitals are at risk of becoming financially unviable under what is known as case mix or activity-based funding. Professor Bob Farnsworth, chair of the Sydney Illawarra Area Health Service Advisory Council, said Mr Rudd's reforms were appalling and potentially a disaster for New South Wales as taking healthcare back 20 years. It gets even worse, Madam Deputy Speaker, because John Deeble, the co-architect of Medicare, said in the Sydney Morning Herald today in an article the $50 billion reform package is largely spin. He goes on to say, will all of this reduce the blame game? Of course not. This policy document is full of it. He goes on to say that with two tracks for funding and decision making on every issue, there's huge potential for blame shifting. Madam Deputy Speaker, I am very concerned. The hospitals in my electorate, those small regional hospitals, are important for the health benefit of our community. They're important for the employment and economic viability of those small communities, and they are the essence of community spirit. This Prime Minister and Premier Keneally need to come out and rule out any closure of hospitals in my electorate. What we will see is a consolidation into the John Hunter, Maitland and Mater hospitals, and that will have a dire effect. I don't think that this Prime Minister nor the Premier of New South Wales understand what it's like to sit in an ambulance and travel an hour and a half to the closest hospital if they shut down these hospitals in my electorate. I'm calling on the Prime Minister and the Premier to be strong. And if ever I saw evidence that they wanted to put more pressure on the major public hospitals, it was last night when the push again to push through the Senate the private health insurance rebate reduction scheme. What they should be doing is alleviating the pressure on public hospitals, and you won't do that by closing down the small regional and rural hospitals in areas such as my electorate.
Time has expired.